Welcome to this video on ECG interpretation in the emergency department. This clinical framework is based on the authoritative Tintinelli and Rosen textbooks. A systematic approach to ECG reading is essential. Always assess rate and rhythm, axis and intervals, along with P-wave, QRS, and Saint/T-wave morphology. Finally, compare with any old ECGs. Rate and rhythm analysis involves evaluating tachyarrhythmias as narrow or wide complex, identifying AV block degree for bradyarrhythmias, and ensuring the presence of a true sinus rhythm. It is critical to know standard intervals and normal values. Abnormalities in the PR, QRS, or QTC intervals can indicate AV blocks, bundle branch blocks, or risk of torsades de pointe. When identifying STEMI, localization helps pinpoint the culprit vessel, septal and anterior, LAD, lateral circumflex, or inferior, RCA or LCX. Look for reciprocal changes to confirm posterior involvement. Be aware of STEMI mimics. A new LBBB with chest pain is a STEMI equivalent. Pericarditis shows diffuse, concave ST elevation, and PR depression. Benign early repolarization has a fishhook J-point. Hyperkalemia is the quote-quote mimicker, evolving from peaked T waves to a widened QRS, and eventually a sine wave pattern. It can present as any arrhythmia or pseudo-STEMI. In pulmonary embolism, the most common finding is sinus tachycardia. Other signs of right heart strain include S1Q3T3, T-wave inversion in V1-V4, and a new RBBB. Tricyclic antidepressant overdose causes QRS widening. A QRS duration over 100 milliseconds increases seizure risk, and over 160 milliseconds increases ventricular arrhythmia risk. Look for a terminal R wave in AVR. Patterns of sudden cardiac death include Brugada syndrome, which shows COVID street elevation. Hypertrophic obstructive cardiomyopathy, HOCM, presents with deep Q waves. WPW features a short PR interval and a delta wave. The golden rule is to treat the patient, not the ECG. Serial ECGs are vital, especially when looking for pre-infarction warnings like Wellens and de Winter T waves. Always correlate findings with the patient's vitals. Thank you for watching this video. The content was built with reference to Tintinelli's 9th and Rosen's 10th editions. You can find my contact information on the screen. These are the image sources used throughout this video.